This didactic content is intended for global training and educational purposes only. Candela Corporation and its affiliates make no representations regarding federal, state, local laws, or regulations that might apply to use and operation of this device. For this reason, please review your country's current indication for use as provided by the respective regulatory agency. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Treatment considerations are under the discretion of the qualified licensed healthcare professional. Individual healing times, discomfort, treatment results, and satisfaction can vary. Please discuss these as well as risks and benefits of this procedure with your qualified healthcare professional to determine whether this procedure is appropriate for you. With that, I am very pleased to introduce Meghan Murphy, RN, BSN.
Thank you. Hi, everyone. My name is Megan. I have worked with Candela. I worked with Candela full-time for 5 years before I transitioned to the role of a clinical consultant. I was very lucky and I was able to work in the corporate clinic where I participated in clinical trials. I actually administered the treatments in the clinical trials and still continue to do so now. One of my absolute favorite devices that I've ever worked with, and I've been in the field for over 15 years now, is the Nordlys. So I'm really excited to talk to you about that tonight. And there's just a little bit more about what kind of makes me tick as a provider and my Instagram. So I'm really looking forward to this time. Please ask questions when they arise and we will get to them as fast as we can. So thank you everyone for attending. Okay, so just a little bit of a quick overview. The Nordlys does, in my opinion, compared to other IPL devices that I've used, kind of act a little bit more like a laser in some regards, which is interesting. And so when we're differentiating intense pulse light to true laser, we have to remember that with intense pulse light, we're giving multiple wavelengths at once. And so that kind of allows you, depending on the wavelengths it offers, to target blood, water, and melanin all in a pulse, again, depending on the wavelengths it offers. So IPL is non-ablative. So what that means is that it does not disrupt the top layers of the skin. So just something important to remember, especially when you're talking about post-care. Now, the Nordlys is known for its IPL system, and we refer to that as the Selective Waveband Technology. And so there's 3 elements to that. There's the ability of it to offer tightly filtrated wavelengths. There's also water filtration in the handpiece, and you have the ability to deliver very short pulses. So if anyone here is familiar with our V-beam, the V-beam, one of its claims to fame is its ability to address pretty much anything vascular or blood related. And really the ability of the V-beam to do that is because of its short pulses, which the Nordlys can also deliver as well. And so that's a really important thing, and it's kind of hard to find with most IPL systems. So we'll get into that in a little bit later. Oh, I went a little too fast. Okay, so when you're looking at the hand pieces on the Nordlys SWT, they're basically going to filter out wavelengths anywhere from 400 to 950 nanometers. Now, when you compare that to other IPLs on the market, those are a little bit different. So those IPLs can go anywhere from 515 up to 1200 nanometers or 300 to 1400 nanometers. So what's really important when you're looking at an IPL system is you want to try to decipher what wavelengths the system offers. Now, remember, anything past 950 nanometers of light, you're going to start to be absorbed by water. And then anything below 400 nanometers, you're going to start to offer UV light. And so you really want to pay attention to what wavelengths your IPL is offering. And the reason that I like the Nordlys so much is because of the fact that it tightly tailors the wavelength delivery. And again, we'll get into that a little bit more. So the SWT applicators maximized the reach of the intended targets, which when we're talking about IPL systems, typically our desired targets are going to be melanin and hemoglobin, so pigment and blood. And what we want to do, or what typically will give you the best result or the strongest energy delivery with that is when you're not being absorbed by water, okay? So the ability of the SWT applicators to offer tightly filtered wavelengths allow you to really target melanin and hemoglobin with very minimal absorption by water. Now, because of that, we don't have to cover as broad of a spectrum, so we're able to use lower fluences that are just as effective, if not more effective, while we're also decreasing the risk of targeting water to avoid skin overheating. So I'm not sure if anyone here has worked with other IPL systems. I know that I have. And occasionally when you're using IPL systems that offer broad spectrums of light, that's going to sometimes increase the risk of untoward heating. So you'll see things like blistering or something like that. You don't typically see that with the Nordlys. So there was a really interesting article by Sales et al., and it was kind of an overview of all things IPL. And very interesting is they stated that a key factor in an IPL device's ability to deliver effective results is in its cutoff filters. So again, what filters does the IPL use that you're looking at? Ideally, they would be kind of like the SWT. So it's going to filter out wavelengths in the shallow portion of the spectrum as well as the higher portion of the spectrum. And you can see here, yes, we have handpieces that go up to 950 nanometers, but we also have a handpiece that filters anything past 750, which makes it very good for targeting both melanin and or hemoglobin. There also are 3 true laser handpieces available on the system. That's going to be your 1064 nanometer applicator, which is going to be used typically for like leg veins or onychomycosis or warts. And then you also have the 1550 and the 1940 applicators, and those are your soft tissue coagulation, skin resurfacing, and benign pigmented lesion handpieces. Okay, so here's a video kind of talking about my experience with the system. So let's go ahead and take a listen. So at a practice I had worked at prior, the IPL system that we used offered wavelengths of light from 400 nanometers to 1400 nanometers. Now, for the purpose of this discussion, we are going to refer to those IPLs as broadband IPLs. And in my experience, after having worked with the Nordlys, which offers the selective waveband technology, and a broadband IPL, I just did not see the results on pigmentation and vascularity with the broadband IPL that I do with the Nordlys. Okay, so I have worked with a lot of various systems, and my most recent practice, I worked with a system that offered 400 nanometers to 1400 nanometers of light. And I would treat like an area of pigmentation, and the patient would leave and I was like, oh my gosh, this result looks great. When I see them back at follow-up, all the brown spots are going to be gone. And what ended up happening was everything looked appropriate. And that was because I was causing erythema. I wasn't necessarily targeting the individual benign pigmented lesions effectively. So when you have wavelengths that go past 950 in the applicator, you're getting a lot of water absorption. When you have a lot of water absorption, you're leading to higher temperatures. So therefore, it'll look clinically effective, right? You'll have that darkening of pigment, but really you're just almost bulk heating the tissue versus effectively targeting those melanosomes or those brown spots. Now, something that kind of took me a minute to understand when I first started working with the competitor system, and this is really important. So this is the yellow here is our PR530 SWT applicator versus a broad spectrum IPL with 515 nanometers. So our handpiece offers 530 to 750 nanometers of light, while the competitor offers 515 to 1400 nanometers of light. And so what you need to look at is, especially when you're talking about, so we kind of know that a lot of lasers and or IPLs work on pigment, right? And that's because pigment kind of has a broader absorption spectrum, anywhere from typically 200 to 900 nanometers. So what we really want to think about is our vascular component. So when you're talking about blood, you want to look somewhere here around, it peaks around 577. So you can see here how our yellow, which is our PR530, is that much more absorbed by blood over the competitor. So that's one of the reasons why the Nordlys is superior when treating vascularity. And I know where I'm at in the Northeast, I would say 70% of my patients present with that diffuse flushing redness or individual telangiectasias or cherry angiomas. So this system in particular really shines on those applications. Now, another thing is, and I thought this graph was good, is you have to think about, okay, if I'm having an IPL that offers light from covering from 515 to 1400 nanometers, that means, let's just say I use 10 joules of energy, that 10 joules of energy has to cover the entire spectrum. So when I'm doing that, that means that I'm getting 10 joules of energy in the water absorbing part of the spectrum, in the pigment absorbing part of the spectrum, and the blood absorbing part of the spectrum. Compared to a system that tightly tailors, I'm not losing energy to the water absorbing part of the spectrum, right? So that 10 joules with the SWT applicator is going to be delivered more effectively versus the competitor device. So what I found is when I was using competitor systems, I needed anywhere from 20 to 30 joules of energy on an individual telangiectasia versus 10, 12, or 15 joules of energy on an individual vessel with our Nordlys. So just something to note. And I talk a little bit more about that here. Through reading, and especially through the work that I've done here at the Candela Clinic with Jinsey, it's very interesting to see how well tailored the energy delivery is and how effective it is at absorbing the intended chromophores. When I started working with a broadband spectrum IPL, I did not see the clinical outcomes that I saw with Nordlys, and I was really intrigued as to why. So I was able to do some deep diving here at the clinic with Jinsey, and then through my own research, I found some very interesting things. So one of the most interesting findings is that the effectiveness of an IPL system is determined by its cutoff filters, as well as how the energy is delivered across the spectrum. In another study that I found, they actually used a tightly tailored IPL system that had cutoff filters between 570 to 645 nanometers. And after 5 sessions, they did see an improvement in collagen growth. So you really don't need the IPL system to go to use energy in the water absorbing part of the spectrum to stimulate collagen, according to this study. So even with a narrowband IPL, they still found that collagen was improved. Okay, so Jinsey is the director of our collaborative research. He's a physicist that I'm very lucky to get the pleasure of working with at Candela. So him and I have done a lot of deep diving into this kind of, you know, the IPL world, if you will. So that was a little bit about that. The one thing that I thought was interesting, and a lot of the competitors will talk about how with the water stimulating portion of the spectrum, that leads to collagen growth. And so, yes, that's true. So if you have our Gentle Max, you know that when you're doing the 1064 skin wrinkle reduction treatment, you're relying on bulk heating to kind of stimulate those collagen fibers. And while that is one method, right, of targeting collagen, so you're bulk heating the tissue, then you're getting the temperature to a certain degree, which then causes the collagen to melt and then reorganize. There is something to be said regarding that study. So I thought that was really interesting. So I do think it's something that you can kind of talk to your patient about, because I always get the question of what can I do for my skin that's preventative? And so where I used to say things like, you know, standard microneedling or the Frax handpieces, which still to me are the best at treating the deeper irregular textural needs. I do think that you could also say to the client, We also have this IPL, or the SWT applicator here, that will target your reds and browns, as well as aid in some collagen. There was a study that did show that it did aid in collagen production. So just something to know. I do think you can kind of cross-sell it in those kinds of things, or at least allude to the fact that there have been studies showing that increase in collagen growth. So the other thing that you have to make sure is that your energy is distributed to the intended target. So here, there's another video talking about this, so we're going to bring that up right now. So here at the clinic, we actually hooked up a spectrometer to the Nordlys IPL system and a competitive broad spectrum IPL system to measure how the energy was being delivered across the spectrum. So this is actually comparing an IPL that had a filter from 515 to 1400 nanometers to the PR 530.
So for this application, or let's say for most of our laser application in our industry, selectivity is very important because we want the specific target to be heated up by these wavelengths instead of any other targets. In this case, the absorption is mainly driven by hemoglobin or blood. And we know the spectrum or the absorption spectrum for blood is mainly within the band of 500 to 600, close to 700 nanometer-ish, which is exactly the wavelength band that is covered by our PR530 handpiece. Meanwhile, if you look at our competitor device, they actually have a blue side cut around 515 nanometer, which is good. However, they missed the long wavelength part, which means there are still other absorptions by, let's say, water, collagen, and melanin, which is not good for hemoglobin-specific applications such as rosacea.
When you have a broadband IPL system and it's giving light from 400 nanometers to 1400 nanometers, the energy is going to be distributed differently across the spectrum. And so what's really interesting is when you look at the yellow, which is our Nordlys, versus the broadband IPL, which is the green, you can see here the hemoglobin absorption peaks around, let's say, I think it's 577 nanometers, but somewhere between 500 and 700. So you can see here, as Jinsy alluded to, when you're targeting things like hemoglobin, so when you're doing your vascular treatments, let's say rosacea, individual telangiectasias, cherry angiomas, you want your energy to be absorbed by hemoglobin. So you can see here, Nordlys, which is our yellow, is more absorbed, the energy in the Nordlys is more absorbed by hemoglobin than the competitor broadband IPL system. The other part that Jinsy is describing, which is very interesting, is when you go out past, let's just say 900 nanometers, you start to have water absorption. So you can see here at 900 nanometers, the yellow is our Nordlys versus the competitor broad spectrum IPL, which is here. So you can see how much less energy we're delivering in the water absorbing part of the spectrum as compared to a competitor device. And that's really important because, as Jinsy said, when you have part of the energy absorption is being absorbed by water, that essentially means that you're not getting as much energy delivery in the desired intended target of hemoglobin. So instead of having, like with Nordlys, most of your 6 joules is going to be delivered and absorbed by the hemoglobin. In a broad spectrum IPL, 6 joules, you have to figure a lot of that energy is actually going to be absorbed in the water absorbing part of the spectrum versus the hemoglobin. So that means, at least what I've seen clinically when using a competitor system, is you need to use a lot higher energies to get the desired endpoint versus Nordlys, because you're not losing energy to the water absorbing part of the spectrum.
Just give you a very simple example of how selectivity works. In one pulse, we treated a piece of skin, and inside that piece of skin, we have everything, right? That includes hemoglobin, water, collagen, and melanin. And now selectivity comes because different components has different absorption characteristics. Now, if we have, let's say, our PR530 handpiece with a wavelength range in this shape, the absorption by hemoglobin is very high. However, the absorption by water or other components are relatively lower, which means other components such as water are not heated up. And the hemoglobin, the interesting part, the targeted part, is heated up much higher, to much higher degree temperature. And that's how selectivity comes to work.
So essentially, if you're trying to target vascularity, you would like high selectivity. So with the Nordlys, you have high selectivity because the energy is just being deposited mainly in the hemoglobin absorbing part of the spectrum, which allows you to create higher temperatures inside the vasculature. Whereas if you had a system that was, losing energy into the water absorbing part of the spectrum, they're not going to be able to create those high thermal temperatures with lower energies like we see with the Nordlys. So that was a really good point. Thank you for that. When you're using a broadband IPL system, you are going to have what they essentially refer to as bulk heating because you're getting a lot of energy delivery into the water absorbing part of the spectrum. And so what we know, right, is that bulk heating can lead to untoward events. So can you just talk a little bit about when we say bulk heating, what we really mean?
So we mentioned bulk heating. Why do we use bulk? Because in this case, bulk heating means water heating, and water is everywhere inside the skin, which is why we call it bulk heating. And now, because it's everywhere, so there's no selectivity, and the whole piece of skin is heated up to a certain degree, and this temperature might be too high to cause some unwanted adverse events, such as a blister or pain.
Essentially, it's very hard to control that degree of thermal injury because a lot of your tissue is comprised of water. So when you're heating up such a large volume, there's a very narrow therapeutic window between an effective temperature and a temperature that may be too high that may lead to untoward events. Okay, so again, that was Jinsey, the director of collaborative research. I don't know if we introduced, I know I said it earlier, but I just wanted to reiterate that. Okay, so the other nice thing about the Nordlys system is because it offers such tightly tailored wavelengths, you have very minimal bulk heating, so you don't really need a ton of contact cooling. On top of that, there is water that filters through the handpiece, so it does help remove any bulk heating that there is. It's not quite as strong as if you were to use contact cooling on another system. But because, again, we're not using high energies, we don't really need that. Now, the nice thing is because we don't have, an aggressive contact cooling system or aggressive forced air cooling system, the system is pretty quiet. So most people do find that to be kind of a nice feature. Okay. The other thing that's really cool about the Nordlys, and this is one of my favorite things clinically, is the ability to deliver. You can actually make your own pulses. So you'll see later in the PowerPoint, we have a really great before and after from an outside physician, and they tailored their energy delivery to deliver 3 pulses. So they took like 6.2 joules and delivered it in sub-pulses. So you can do that, or you can deliver it in 2 sub-pulses, or you can deliver it in a single pulse. So for me, clinically, when I'm treating diffuse redness, so if I have a patient that presents with flushing, when you work out, do you flush? And they say yes. And you can kind of tell those patients because they'll come in when it's really hot or when it's really cold and their kind of cheeks are really pink. I will use this single pulse duration setting because I think that's most effective there. And I also like the single energy delivery for telangiectasias or individual vessels. Where I do think it's a good idea to use the split pulse setting, that is going to be when you're treating a darker Fitzpatrick skin type, if it's the patient's first appointment and you want to kind of go easy on them. And those settings are going to be found under the photorejuvenation setting or the rosacea setting But again, if you choose the setting, it'll show you. So the only way to get the single pulse setting that I'm aware of is to use the individual telangiectasia button setting on the system. Now, the other thing you have to think about is, how do I avoid purpura? So bruising is always a possible side effect when you're targeting vasculature or blood. And so if you have a patient that really doesn't want any bruising, feel free to use that photo rejuvenation setting, because it's going to take your total energy delivery and deliver it with let's say you take 7 joules. It'll deliver 3.5 joules, have a 10 millisecond delay, and then deliver the other 3.5 joules. But if you're not seeing your endpoint and you've gone up a joule to 2 joules from the recommended setting with the split pulse mode, consider going to the individual telangiectasia setting mode, ideally at the next appointment if you've already done a couple of passes. So again, this is just showing the pulse duration. So remember that your pulse width is the same thing as your pulse duration, which is essentially how long the tissue is exposed to the energy delivery for. And so pulse duration, you really pick your pulse duration based off of the intended thermal relaxation, the thermal relaxation time of the intended target. So in an ideal situation, you're using a pulse duration that is shorter than or equal to the thermal relaxation time of the intended target. And so what we know is, by using a pulse duration that's shorter, we're able to isolate the energy delivery, and it's going to heat up the intended target to the effective temperature before it's able to diffuse out to the surrounding tissue. And so you can see here, the SWT Nordlys applicators has the ability to go all the way down to 0.5 milliseconds, which is huge when you're treating resistant pigmentation. I actually will use that sometimes, and or vasculature. Okay, so I had to do some digging for this, but with a short pulse IPL at roughly 1.5 milliseconds showed a 60% improvement in reducing facial redness after 2 treatments spaced at 4-week intervals. So shorter pulse durations are better able to target fine telangiectasias, which is a component of diffuse and persistent erythema of the face. So when you're looking at your patient, you want to try to differentiate what exactly you're seeing. If you're seeing a patient who presents with the flushing component, but you don't necessarily see individual telangiectasias or individual vessels, then you're going to want to use the short pulse duration. If you see a patient who has both, you're going to want to use a short pulse duration, cool the skin. This is how I do it. I use the short pulse duration, I cool the skin, and then I go back over the individual isolated telangiectasias with the longer pulse duration. So I had the ability at my old practice, I would treat any patients that I couldn't clear with their broadband IPL system, and I would use the Nordlys to clear them up. And so you will see here that this is a patient that I had treated, and there's a quick video showcasing this.
The importance of the short pulse duration is that it allows you to treat that really stubborn, resistant, diffuse redness. So on this patient's case, you can see here at baseline, she had very persistent diffuse redness. She also did have some underlying dermal pigment. So what I did was we did 3 sessions of broadband IPL, and then 1 month after those 3 sessions, I performed 1 treatment with the Nordlys SWT PR530 applicator with 1 pass of Frax 1940 over the areas of stubborn pigment patches. And she was so impressed with the results that she asked that she only be treated with the Nordlys moving forward, and can't believe how unbelievable her redness looks now. And so clinically, that short pulse duration is very, very important because it allows you to treat that stubborn diffuse redness. Another thing that I really like the short pulse duration for is these cases of mixed pigmentation. Now, when you have a patient that has mixed pigmentation, you want to be really careful using a lot of heat when treating those conditions. So when you're allowed to use a short pulse duration, this ultimately leads to less heat in the tissue, which therefore allows you the flexibility to treat things that are a little bit more stubborn or maybe don't respond as well to heat, and it causes less risk of exacerbating that condition.
Okay, so now my favorite part, we're gonna get into some case studies. Okay, so this is one of my patients who is really, doesn't really follow any post-care instructions. I kind of understand that every summer they're going to live their best life and go back out in the sun. So we kind of do some maintenance treatments on them. And so what I did here was the 1940 and the 1550. She was part of a study where that was what we were using. And then I did do actually, I think that's all I did. I don't think she came in for her IPL. Yeah, okay, so you can see here the results. Now, a lot of people are gonna say, well, why would you use a 1940 applicator instead of the IPL applicator? Or I'm sorry, instead of the SWT IPL applicators. And so one thing I wanna point out is she was in the study, so I had to do it that way. But also, the 1940 nanometer wavelength is my absolute favorite wavelength for targeting benign pigmented lesions or anything that you're not really sure what you're treating. So in this patient's case, she goes to derm once a year because, again, she really does live in the sun during the summer. And so she does have what presents as some keratotic lesions. So by using the 1940, I'm able to target those a little bit better. And I'm also getting that nice resurfacing effect that you don't necessarily get with the standard SWT or IPL applicator. Now, one thing I want to note is you need to remember that the Frax 1940 is going to deliver the energy in columns of damage, right? It's not a full laser beam or IPL beam delivery. So when I'm using that, if I'm trying to go after individual lesions that are resistant, I'll decrease my scan width down to 4 millimeters, and then I'll do 2 to 4 passes over each individual brown spot until I can really clear it. And that is another reason that I absolutely adore our 1940 nanometer wavelength, our Frax 1940, because it allows you the ability to really tightly tailor how you're delivering it. The other thing that's of importance with our Frax system is when you're plugging in the settings that you're going to use, it will actually show you the depth of tissue that you're affecting in the dermis. So that's a huge thing to me, right? Because if I'm treating, let's just say, a benign pigmented lesion, I know that I could get away with using a shallower depth of energy. But if I'm treating really deep wrinkling, then I want to use a deeper depth of energy to really get into that, or let's say a scar. And so that to me is really important as a clinician. It allows you to really hone in on exactly what layer of the skin that you're targeting. So that's really important to me. So these are the settings that I had used on this patient. You do have to remember that when you're off face, you don't have the adnexal structures that the face has. So you don't have things like, well, you have some hair follicles, but not typically as many as you do on the face. So you do want to consider keeping your energies a little bit lower than you would if you were on face. Now for her, by the last treatment, I did get up, actually even in the beginning treatments, I did get up to 40 millijoules on her hands because I was looking to kind of address some of those textural irregularities. So just some food for thought there. And you can see I definitely do a decent amount of passes and I definitely do a decent amount of energy delivery. But again, the 1940 really is the one that's going to go after some of those more stubborn, benign pigmented lesions. Now, here is a patient that would make me nervous with the standard broadband IPL system. And the reason for that is she has redness, she has a lot of pigmentation under the skin. And, you know, I'm not sure how great she was about following post-care instructions, but you can see here how able we were to target all of her vascularity and her redness and her pigment. So what I did was the Frax 1550 and the Frax 1940. So this study was originally set up that we were only using the Frax handpieces, and then for their fourth and final treatment, they could come in for a final SWT IPL. One thing I want to note is the Frax 1550 and the Frax 1940, they're going to deliver the energy in columns of damage, and they're going to coagulate tissue, meaning they're causing temperatures at least of a minimum of 67 degrees Celsius. And so because of that, it's a very strong energy delivery. And so part of the wound healing process is you're going to get, as you get new tissue growth, you're also going to get some new blood vessel formation. It's called angiogenesis. So occasionally in your patients that have done a series of Frax treatments, you may find that, let's say at the third appointment, they come in for their 1 month or 3 month follow-up visit, and they're complaining a little bit of this kind of persistent redness. Absolutely feel free to include a SWT IPL treatment in their treatment plan after 6 to a minimum of 6 weeks, because that can really just go in and clear any of that residual redness. Anytime I do a resurfacing treatment or a CO2 laser or something like that, you're going to see that persistent erythema, and that's just part of the process when you're stimulating new tissue growth. So I would just include that in. Now you can see here, one thing I want to note is I personally don't see a huge improvement in wrinkling until I get to a minimum of 50 millijoules on the Frax 1550. But do remember that higher energies equal deeper depths, and also are probably most likely going to result in higher degrees of swelling. So if you have a patient that doesn't want any downtime and they're worried about that, you probably don't want to go as high as I go here. These patients were okay with swelling. They understood the risk. They were fine with it, but you just want to pay attention to that. Now, the other thing to pay attention to that I don't know that we highlight enough is your total delivered energy. So I know that I've had a good treatment on the Frax 1550 when I'm over, I mean, really, it's like at least over 2 kilojoules, which is this number to the far right column. Potentially, I've seen as high as up to 4. And then with your Frax 1940, you'll see really good results when you're at least at 1 kilojoule, okay? So you can see here at the final session, we went all the way up to 4 kilojoules total delivered. And then you can see here at her final session is where we did her IPL. So to target her diffuse redness, I used 5.8, 1.5 milliseconds. Then I leave the skin alone for at least 1 minute to 2 minutes. Then I went back over each individual vessel, and I went 13 joules, 13 milliseconds, cooled the skin again. I did another pass at 5.6, 1.5, cooled the skin again, and then went 10 joules, 10 milliseconds on the finer telangiectasias. Now, here's another case. Okay, so in an ideal situation, she would probably have a fully ablative CO2 laser. She did not want that downtime. That's just not something she's interested in. She is a heavy smoker. She doesn't really want to give up on the smoking. But you can see how much healthier and just how much her wrinkle reduction happened with the Frax. So what I tell people is I can see CO2-like results or a fully ablative-like result on patients if you're willing to use the higher energies. Now, in this patient's case, I will be honest, I did use, I think I did 50 millijoules around her eyes, or maybe even 60, and she was pretty swollen. So she did ask at subsequent appointments that we didn't use as high energies, and I ended up not. Now, I do think that will get in the way of your final result a little bit, but it's, you know, if the patient doesn't want that degree of downtime, it's kind of up to them. Now, the other thing that's really nice is you can see how much more even her skin tone is in terms of her brown spots or her benign pigmented lesions. They just look a lot more even. And that's because of the addition of the Frax 1940. And I believe I also did a little bit of IPL. Now, my favorite treatment ever, and I would try to convince all my patients to do this, would be the combination of the SWT IPL applicators with the Frax handpieces. So we call that our light and bright treatment. And if you're going to do that, you always want to start with your IPL applicator first, and then go back in and follow up with the Frax 1550 and then the Frax 1940. just remember that that's kind of an aggressive treatment. So there are times where here I did do 3 passes, but my total delivered energy is a little bit lower because I knew that I was going to be doing both wavelengths. And you can see here that I also did target her individual vessels with the 10 joules, 10 milliseconds, and the 6 joules, 1.5 milliseconds on her mid cheeks where there was some redness. Now, another thing that I want to note is a lot of times we get questions about how to determine what pulse duration to use. So if you look at the system, it's got a little red dot. When you go to individual telangiectasia, it's got a little red dot, a little fine telangiectasia symbol, a medium telangiectasia symbol, and a thick telangiectasia symbol. And so what you want to remember is the little red dot is going to give you 1.5 milliseconds and is supposed to be used in cases of flushing persistent erythema. The next squiggly or the next individual telangiectasia button is for your small telangiectasia. And if you guys go to the user manual, it'll tell you exactly what diameter it considers a small telangiectasia. So you can measure the individual telangiectasia and it'll go over the, you can measure the width of the vessel and it'll help you align what pulse duration to use. So we have a question here. Do you have any recommendations on an in-person or online resources for laser training? Newer to lasers and wanting to find training that goes over how to choose energy, pulse time, et cetera, in settings. Hi, Angie. So I'm not sure if you own the system already. Candela does offer really comprehensive training with their products. And for example, with the Nordlys, there's a whole clinical workbook that's really, really in depth, and there's a ton of videos on their portal. The other thing I want to let you know is that Google Scholar is my best friend. So for example, there's a paper that was quite a long time ago by Dr. Kenkel, Kenkel, and it says the 5 parameters you must understand to use laser or something like that. And so just put in 5 parameters of laser and just keep the dates open because I believe it's somewhat of an older article. And those kinds of things really helped me. So again, I would reach out to your Candela, your salesperson as well, but in the meantime, you can also try Google Scholar. So the most common SWT applicators so the most common SWT applicator that I use is going to be the PR530. That's kind of the workhorse of my practice. But don't forget, I'm up in the Northeast, so I see a lot of lighter Fitzpatrick skin types. If I was in an area that was treating a broader array of skin types more frequently, I would want both my PR530 and my VL555. Your VL555 applicator it's less absorbed by melanin. And so when you're treating a darker Fitzpatrick skin type, you have to remember that they have a higher melanin content in their epidermis. And so that actually can create kind of a competing chromophore. So you want to use a system or a laser or an IPL applicator that's actually a little bit less absorbed by melanin to protect the darker skin types, at least in the beginning. But that was a good question. Thank you. So you can see here, this is 3A. And so you can see my treatments are somewhat laborious just because there's quite a few steps involved in each and every one. But again, you can see on this patient in particular, we did use really high energies to kind of go after her individual textural irregularities. Now for your pulse duration on the Frax handpieces, I just adjust my pulse duration to get my desired energy delivery. That's really how I decide that versus like with the SWT applicator, I'm really thinking about, okay, what's my intended target? What parameters do I want to use? Things like that. So here's another case. She kind of had this matted appearance of individual telangiectasias. And so what I did was I used the PR530. I isolated the lesion by using wet white gauze around it. And I just targeted those individual vessels. So you can see here, these are the settings that I used. I used anywhere from 10-10 to 13-13. And then at the last session, once the telangiectasias had cleared a little bit, I did decrease my settings down to 12 joules, 13 milliseconds. Now, one thing you want to know is with higher energies, when you have, if you look closely, they're quite matted, right? So they're really close together. So because of that, you're going to get a decent amount of heat diffusion. So just if you're doing things like, you know, maybe you would want to start by tracing out that middle bigger vessel and then kind of cooling the skin around it. So use an ice pack after, cool the skin, then take the ice pack off, let the skin get back to kind of a normal temperature, and then you could go after the ones adjacent to it. You just want to be careful because this is kind of a unique clinical presentation in the fact that it they're all so close together. So, you know, you just want to decrease the risk of too much heat or anything like that. Hi, Maria. Do you generally decrease the percent coverage when using increased energies on the 1550? Okay, it's kind of hard for me to answer that question because coverage is determined as how much surface area you're affecting in a given area. So let's say the cheek. So because I do that thing, so what I end up doing is I'll do 12 millimeter scan width over the full cheek. Then I'll decrease my scan width on the 1550 to 4 millimeters, and I go over individual wrinkles. So I may only do 2 passes with 12 millimeters, but then I'll do 2 passes with 4 millimeters, and then I go back over with 1940 12 millimeter scan width. Then I decrease it to 4 millimeter scan width over individual brown spots. So I don't necessarily decrease my coverage with higher energies because I do such a uniquely tailored treatment plan that it ends up still being a high coverage. Where I do decrease energy is around the eyes, especially if you can tell the patient has herniated fat pads. I have herniated fat pads under my eyes, and no matter what treatment I do, I swell really quite aggressively. So if you have a patient specifically, and I've noticed it more in the patients with herniated fat pads, but if you're going to go and treat them and you're trying to get like the periorbital rhytids, consider just going to like maybe only 10 millimeter scan width and using like 40 to 50 millijoules instead of upwards of 60 millijoules. The interesting thing is about the Frax handpieces is in my clinical experience, there's very low risk of adverse events. So I don't, except for PIH, you do have to be careful about PIH. So I guess it depends on the patient. If it's a lighter Fitzpatrick skin type, I'll think about the coverage, but I won't be super concerned. Where I do really think about the coverage is my darker Fitzpatrick skin types. So consider using wider scan widths for your darker Fitzpatrick and keeping your passes lower so that your coverage overall is lower. Hi, Brian. So this is a good question. How do you decide on using the PR530 versus the Indy YAG laser for telangiectasias? So whenever I can, I'm going to try to use the PR530 on specifically facial vessels. The PR530 is has a little bit less of a risk associated with it, as does the Indy YAG applicator. You have to remember, this is kind of the shorter version of it, but the 1064 goes pretty deep into tissue and there's kind of a low therapeutic window with it. So you have to be really careful when you're treating individual vessels with it because it can lead to tissue ulceration if you're not careful. So whenever I can do the PR530, I'm always going to default to the PR530. The only time that I've not really, and actually I've never really not cleared a vessel, to be honest, with the PR530. The only time it gets tricky is if the vessel is really blue and thick. If it's a thicker, bluer vessel, you might need to use the 1064 because the bluer the vessel, the thicker the vessel, typically the deeper in tissue it is. And the YAG can go a little bit deeper than the PR530. Just really quick, if you're using the 1064 on the face, you want to make sure that you skip 2 spot sizes between each pulse delivery so that you decrease the risk of heat diffusion. But that was a great question. Thank you. Okay, so this is kind of what I was referring to earlier. So I kind of want to talk about this because I think this is so cool. So if you have a patient who presents with acne, you do want to, there's a couple of different ways you can approach acne. One is to target the vasculature in the actual acne lesions themselves. And so similar to diffuse redness or persistent facial flushing, when you see somebody who has acne, the acne is going to be fed or stimulated by a blood flow to that area. And so if you use the IPL to coagulate the vessels within that feed that acne, you can kind of keep it at bay. Now, the way I think about this is when I'm looking at an IPL when I'm thinking about doing IPL treatments for acne, I kind of think of that as more maintenance. I don't necessarily think of it as a lasting effect, if you will. Like I think I would, if I was to do IPL, I'd probably do like, if I was just doing IPL, I'd probably do sessions like every 2 to 4 weeks and probably do 6 to 8 sessions kind of situation. But what's interesting is if you go in with the 1550, right? So if you go in with the 1550 at a deeper depth, you're able to actually go directly after the sebaceous gland. So therefore damaging it further. So you can target the vasculature with the SWT IPL applicators, but then you can go over that with the Frax 1550 applicators. When you're using a deep enough energy delivery, you're actually going to start to damage the sebaceous gland, which can then lead to longer lasting results on acne. So whenever you can, try to upsell your client into that. I've even seen a nice clearance in acne with the 1940 nanometer wavelength as well. Again, on the higher energies, I do think you start to hit the dermis and you can start to kind of negatively affect those sebaceous glands. Hi, Julie. Please review why we should use less energy on telangiectasia vessels than the energy used on diffuse redness rosacea. Okay, so let's go back to this setting here. We don't necessarily use less energy on telangiectasias because we're using 10 joules of energy, 10 milliseconds pulse time. Unless you're referring to the pulse duration. Okay, so your pulse duration is your time on tissue. So your pulse duration is measured on the Nordlys in milliseconds. You pick your pulse duration based off of the intended thermal relaxation time of the target. So basically, you want that target to heat up. You want to hold the heat for just long enough so that it negatively affects that target. And then before it can diffuse out and get less hot, if that makes sense. So when you're looking at somebody who has diffuse redness, the vessels that cause diffuse redness or the flushing component of that pathology are really, really small. So they're going to heat up really fast, but then they can lose the heat really fast. So if you use a longer pulse duration on those mini vessels, they're going to heat up. And then before they can reach the damaging temperature of 67 to 73 degrees Celsius, the heat will start to spread out. And so the effect won't be as effective, I guess. Now, with individual vessels, they're bigger, right? The ones you can see are bigger than the ones that cause the persistent facial erythema that you see. So you have to think of it as you want the blood inside the vessel to absorb the light, convert it to heat, and then the light goes from the middle of the vessel to the vessel wall and collapses that vessel wall, coagulating it. So shorter pulse durations on a smaller target, right? So the milliseconds are shorter on a smaller target versus a thicker target. You need a longer time for the heat to go from the inside of the vessel to the vessel wall. Now your energies are actually going to be higher. Your joules are going to be higher with individual vessels than with diffuse redness. So I hope that answered your question. Okay. So we have a question here. What is your preference for lower extremity telangiectasias, PR 530 or 1064? Great question. Okay, if it's a bluer vessel, I'm always going to default to 1064. with the extremities in general, I tend to find myself defaulting to the 1064 nanometer wavelength. And I'm not, to be honest, I don't always know why I do that. I was reading in the user manual the other day that they have done cases of telangiectasias off the face with the IPL applicators, but I just always default to YAG off face. So if you were to try it, you would just want to go a little bit slower because, again, there's like the melanin absorbing component thing, and then the fact that your legs just don't heal as well as your face. But it's a great question. And to be honest, I don't know that I've used it enough to really say, even though if I had the V-beam, I would use the V-beam. Like I use the 595 on vessels quite a bit. So thank you again.